The National Medical Association is the largest and oldest association in the country representing the interest of Black physicians. And since our inception in 1895, we have advocated for medical education, supported Black physicians, and worked to eliminate healthcare disparities for Black patients and all underserved or underrepresented minorities in this country.
It's certainly my distinct pleasure to introduce one of the world's most generous philanthropists, most successful entrepreneurs, and foremost champions of public health. He's the former mayor of this great city and someone whom I'm glad to call a friend. In 2020, Michael Bloomberg and his Bloomberg Philanthropies donated $100 million to the 4 historically Black medical schools. Mike's gift has helped ensure that more talented students decide to go to medical school and then make it to graduation. But it also allowed them to make big choices. So we now have medical students who would not have considered neurosurgery or urology or surgical oncology like myself, who now feel emboldened to be able to do that. That freedom of choice is extremely important as we talk about diversifying our medical healthcare system. But just as importantly, our 4 historically Black medical schools also provide competent, culturally competent physicians for the nation's workforce. So we do not only educate Black medical students, but we actually educate medical students from all races and ethnicities, and we give them that cultural competency that allow them to go into our communities and make sure that these disparities are eventually eradicated. Ultimately, our medical schools exist for one reason and one reason only, and that is to amplify the humanity of others. And today, while we will celebrate the largesse of a very large gift, let it not be lost in our celebrations today, that what Mr. Bloomberg has done today is to amplify the humanity of many of us in our segment of the community. And for that, we will always be grateful. So without further ado, Mr. Mike Bloomberg.
60 years after the Civil Rights Act, a person's race and family income still affect how long they are likely to live. And sadly, race and income still affect people's ability to get a great education and pursue their dreams. That's unacceptable, and I believe every sector of society, public, private, and nonprofit, has an obligation to confront it. As the data clearly shows, and this group knows from experience, when Black patients are treated by Black doctors, in many cases they get more frequent care, more preventive care, and better health outcomes. So by increasing the number of Black doctors, we can help to save more Black lives and reduce inequality in American health. And that will also help to address racial wealth inequalities, because debilitating health problems take an enormous economic toll on families and communities. Those 4 schools alone graduate around half of all Black doctors in the United States, which really is an astonishing start. So there's no ways to overstate how important they are to equality in medicine. Their presidents are with us today, and I want to thank them, all of them, for their leadership. Dr. David Carlisle of Charles Drew University of Medicine and Science, Dr. Ben Vinson of Howard University, Dr. James Hildreth of Meharry Medical College, and Dr. Valerie Montgomery Rice of Morehouse School of Medicine. I've had the chance to talk to and learn from some of the students of each of those schools who have now gone on to become doctors. And since we have some of their students and graduates here with us today, I would like to ask anyone who has ever graduated or attended one of those 4 medical schools to stand up and show, let's give you a round of applause. But we have much more to do to build a community, a country where every person, regardless of race, has equal access to quality care, and where students of all backgrounds have the chance to enter medicine. At Bloomberg Philanthropies, we want to do our part. And so today I'm glad to announce a new gift to America's historically black medical schools from Bloomberg Philanthropies, $600 million. Thank you. Thank you. The new funding will bolster the endowments of these 4 medical schools. We will also be making a gift to establish a new medical school at Xavier University in Louisiana. That is an HBCU with a strong track record of sending graduates into medicine. To put it in perspective, this gift will more than double the total endowments of 3 of those 4 medical schools. You know, when I was told that it's the largest gift ever given to HBCUs, I thought of the 2 people who would have been most proud of it today. My mother and my father. I've told this story before, but one of my earliest memories of childhood was sitting at the kitchen table and watching my father write a check for $50 to the NAACP. We didn't have very much money, and we weren't black, so I asked my father why he was making the gift. But he said something that have stayed with me the rest of my life, all my life so far, and I will the rest as well. Because discrimination against anyone is a threat to all of us. And I've carried that lesson with me throughout my life, and this is one more way that I'm trying to honor what my parents taught to me and to pass that lesson on to my grandchildren. When the National Medical Association was founded in 1895, there were 14 black medical schools compared to only 4 today. Lack of funding and support, driven probably in no small part by prejudice and racism, forced many to close their doors. We cannot allow that to happen again, and this gift will help ensure it doesn't. Diversifying the medical field is a society-wide challenge. Philanthropy can't do it alone, but we hope this commitment will help to attract more support.
Today, we share a profound commitment to addressing the pressing healthcare needs of our communities. We gather today to celebrate the transformative $600 million gift from Bloomberg Philanthropies. This is monumental. It's a monumental step towards advancing our mission. Together, these investments represent a commitment to change, a commitment to create pathways for aspiring healthcare professionals who reflect the diverse fabric of our society. Our mission is clear: to educate the next generation of healthcare professionals who will return to their communities, delivering quality care and making a lasting impact. So we are excited today. We believe that if something is right, the entire universe conspires with you to make it happen. Thank you for standing with us. Thank you for guiding us. Thank you for continuing to understand that all of us have a role to play in the success of leading the creation and advancement of health equity to achieve health justice. Thank you, and enjoy the rest of your day.